Hey guys, Dr. Kyle Lovelace here. Hey, I wanted to take a moment to shoot a video on shoulder pain, lower neck pain, and then just that arm pain in general, whether it's numbness, tingling into the hands, or actual pain in the shoulder. Over the last 10 years in practice, I've seen a ton of people come in with these issues and many times misdiagnosed. So today I'm going to talk about the three main things that I recommend that I actually do with every patient that comes in with these issues to figure out, number one, what's causing it, and number two, actually how to fix it as well. The most common thing that I see coming in with shoulder issues as a diagnosis is going to be a rotator cuff issue where the actual rotator cuff in the shoulder is torn, or they're told it's torn, or bursitis, where patients are told they have a bursitis issue in their shoulder. Most of the time, those aren't the case. Sometimes that is the case, but even the problem with that is that the medical answer for that is we're going to inject it with a steroid, and that steroid injection, although it might get rid of the bursitis and reduce inflammation in the short term, in the long term, it's actually going to make the ligaments and tendons and everything else weaker, which will lead to a rotator cuff tear. So it's not a good idea. Not only that, it's not actually fixing the reason your bursa was inflamed in the first place. So I want to talk about the three most common things that I see in our clinic over the last 10 years with shoulder issues and neck issues. And I say and neck issues because it's all kind of like one complex of pain that people will get sometimes, or it could just be directly in the shoulder. If it's there long enough, you'll start to get the tingling, numbness into the hands and everything else. Now you can see these posters behind me, and I have these here to kind of as a teaching mechanism, I guess you could say. So you have the shoulder right here, right? And in that shoulder, you can see all the nerves that come out of the neck. It's a huge bundle of nerves. They call it the brachial plexus. And that's what really feeds the nerve supply to your arm. Okay, so your brain sends signals down the spinal cord, that goes out nerves, that tells your arm to work, tells your muscles to move and all these things that you want to do, right? So it wraps around the shoulder. What I found the most common issue with shoulder problems is actually not directly in the shoulder. Although the pain is there, it's created muscle issues there, the actual root cause typically is coming from the lower neck. Okay, the C5 bone in the neck are the nerves that go right to the shoulder. C4 up into the traps. You got your scapular, excuse me, your scapular nerves that control your scapula. And for your whole shoulder to work, it all needs to be able to move. For instance, when you get to here, right, when you get to this position, now your scapula has to move out of the way for you to continue to go to here. Okay, when someone gets stuck here, they call that a frozen shoulder and they can't get past here. It's because that bone on the scapula isn't moving and it actually pinches it. The acromion process actually pinches right there and can become inflamed and painful, but you can't move past here. So the answer is not break up scar tissue in the shoulder. It's typically coming from your spinal accessory nerve in the neck. And when we start to adjust the neck and release the scapula in the shoulder, now you can get full range of motion. This can be a very quick process as well, which is really cool. So number one thing I do when someone comes in with a shoulder issue is I will evaluate and feel. Okay, so I actually feel the shoulders, and just from feeling and just from a few orthopedic or range of motion tests, I can tell if it's a direct shoulder issue that has nothing to do with the neck, or if it's a shoulder issue. Most of the time I can tell, or if it's a neck issue. So the first thing I do is, after we've decided, okay, there's definitely more than just the shoulder going on here, the first thing I do is I actually take x-rays of the neck. Okay, I want to see if there's any disc issues in the neck. I want to see if that patient has forward head posture more than I can just see on the from their posture. I want to see if there's any disc degeneration, disc loss, if there's any bone spurring. All those things will cause numbness, tingling, or beginning can just cause pain. Many times we'll see pain just right here, right where the bicep tendon goes through, and it's coming from the neck. Or we'll see pain right there, right at that point of the deltoid. Or many times it'll be right back in there, okay? And so the first thing I do is I take x-rays, and I see those x-rays, and then we can say, okay, yeah, this is definitely, we need to correct the neck as well. When you lose the curve in your neck, when your head goes forward like this, all the weight of your head goes into your shoulders. Let me give you a spine example here. So you can see the spine here, right? So you want a nice curve in the neck, and it should line up with the rest of the spine. What's happening from car accidents, injuries, falls, sitting on computers all the time, all those things, the neck's doing this. People are coming in like this, right? And you can see all the weight now goes right here. Well, that can push the discs into these nerves. That can cause stress in the spine and cause irritation to the nerves and inflammation in the nerves. That can also cause the bones to break down and cause bone spurring in that area and cause disc degeneration over time. So absolutely, if you're here, most likely your shoulder problem's coming from your lower neck. Okay, we got to get your curve back to here. Okay, does that make sense? Hopefully you say yes, right? Let me get that back on there. Okay. Now, I just had a patient come in yesterday, and this is what led me to want to shoot this video, is they had a car accident, right? Pretty severe car accident. had a whiplash injury, have pain in their neck, numbness into the fingertips, pain down their legs, pain in their back. And they've been going to a physical therapist for two months now. They've been going to orthopedics. Now they're getting referred off to a neurologist. And they just and what they say is that they can't figure out what's wrong with me. They don't know why I'm having these problems. And I'm just sitting there like, well, it's pretty obvious why you're having these problems. She said they took x-rays, they didn't find a fracture, they did MRI, they didn't find disc herniations. So that's kind of the medical route. They do those things and they find no fracture, no disc herniations. And they told her she had arthritis in her neck, but that wasn't a big deal. Just so you know, that's a big deal and that can cause everything she's dealing with. But they said, we don't know what's causing it. Well, I can tell you what's causing it just by talking to her, just by looking at the fact that she can't turn her neck. She has inflammation in the lower part of her neck. Her bones aren't moving. They're locked up. They're subluxated, which creates irritation to the nerves, pressure into here. She also has arthritis in her neck, so she's probably having irritation to the nerve, probably hidden from an actual bone. So first step is we got to get her adjusted. My problem, the reason I bring her up is because for the last two months, she's been on gabapentin, she's been on muscle relaxers, and she's been on anti-inflammatories, and going to a physical therapist for 2 months, and she's the same. That's not cool because we're not getting to the root cause and they're shooting in the dark with symptoms. She's going to go to a neurologist now. Then they're going to do all these other NCV tests. They might come up negative, which I've seen plenty of times with people who still are coming nerve problems from their neck. And so the key is we got to get to the root cause. So number one, we have to take the right x-rays. I like x-rays especially for issues like this, that your movements, your head's all the way down in one of them, your head's all the way back in the other one, and then straight from the front. And then, one from the side not moving. And that can give us a good idea of what's moving, what's not moving in your spine, and if there's any degenerated changes, okay? The second step is now we gotta start adjusting the neck. If there's a problem there, now we start to get the neck moving. First thing I do with anyone with a low neck or shoulder issue is I start to traction. We literally pull, so you imagine your head laying down this way, we're literally pulling and tractioning the neck. Or if it's severe enough, we'll put them on a decompression machine, which will get pressure off of those nerves and many times help with disc issues as well. So we're doing a traction. Okay, and then we'll go and I'll move the neck around until I find the area that's not moving, and then boom, we move it. We get a little light adjustment in there, and sometimes you hear a popping noise, gets rid of the inflammation, gets rid of the irritation, releases the pressure. Then we go in and break up the scar tissue and trigger points and all that, breaking up that scar tissue there to increase range of motion. And the final thing that I do, a lot of people don't do, even the chiropractors, a lot of them do, but a lot of them don't, is I'll get in there and I'll actually adjust the shoulder. And so we'll get that shoulder that's many times rotated inwards. You know, I see this a lot of times is when someone's like this, right? They're doing their mouse all the time. Their shoulder literally gets stuck here. I've seen so many misdiagnosed people come in with a bursitis diagnosis or a rotator cuff diagnosis, and all that's happening is their arm's stuck in rotation forward. And I'll just get in there, grab the scapula, grab the arm, and boom, release it back. Many times you'll get a popping noise. It's a huge relief. And all those pains they had when they did range of motion that were there before completely go away. Right? So that's my point, is this: if you're rotated in from being on a mouse, using your mouse all the time, or maybe you sleep on your shoulder and it's locked up like this. I had a patient today that he had pain all through here and I could feel the muscular tension. And so all I literally did is I took his arm because it's stuck like this, went boom, pulled it down real quickly, and all those pains just went away. He was stuck. It was subluxated. Your shoulder can actually get locked up in that position. But here's the thing, is if it's rotated inwards or it's locked in that position, and now you're doing your daily activities, now that tendon, all that musculature that goes through here can now go over that bursa. A bursa is just a sac of fluid that goes in between the tendon and the bone, and it rubs and it rubs and rubs because it's out of alignment, and now you get a bursitis. So if we just inject that bursitis, it'll get better for a moment, but it's making everything else weaker, and it will come back because your shoulder's still like this. So we gotta, boom, release that shoulder, get the neck moving again, and get all this bundle of nerves, get good flow into the nervous system, release any trigger points or scar tissue that's built up. That's the second step. The final thing that we always do is now we have to retrain your body. This is so many times missed. If you're like this and we do everything I just said, and then you go on your way and you feel good, guess what's going to happen? It's all going to come back because you're still like this. This is a muscle memory. You are trained, your body is trained to be in that position. Now, when I do this, that's my big muscles. I'm using those, my movement muscles. I can focus on in moving those. Your postural muscles are subconscious. You don't think about those. So if you're here, this is where your postural muscles have been trained to hold you. We want you to be retrained to this. So we actually have to retrain those postural muscles so that lasts, okay? So that we get the curve back in the neck, and you get your head from here back to here. Now I'll tell you that not everybody that's here is going to be able to get back to here. If there's too much arthritis, too much degenerative change in the neck, and you can't even on your own get yourself back to here, even though it's stressful, but still at least get there, it's not as likely that we're going to be able to get you there. So there is limitations that can happen. That's why it's so important, if you have forward head posture, is to fix it now before you get stuck here. And we've all seen the elderly person that's like this. Well, this isn't going to be elderly people anymore. This is going to be 50, 60-year-olds because they're like this, because we're always on our computers head down. So we got to retrain. It's a neuromuscular re-educating process. So we retrain the musculature to where your postural muscles are in a normal position. And that is the long-term answer. So we have a curve in the neck again. You have no forward head posture. You have scar tissue and trigger points removed. You have full range of motion in your neck, full range of motion in your shoulder. Most of the time, that is the answer to getting rid of a shoulder problem, a neck problem, a numbness, tingling in the hands. Again, I say most of the time, over 10 years doing this, I would 95% of the time. Every so often there's someone that has such a major disc issue that we're just not able to get pressure off. But you always try that first. Or maybe they really do have a torn rotator cuff from throwing a football or throwing a baseball, or an actual accident or injury that they had to that shoulder. And then that's a different case. But the majority of the time people are coming in, they're getting all these crazy diagnoses, going and put under surgery. I've had plenty of people that told they had to have surgery. And by us just doing that process, that simple process I told you right there, they no longer had to have surgery. My patients, one patient I can think of right now, Sherry, this is I think 4 years ago, she came in, sat in a room with me and said they're telling me I have to have neck surgery. No one can do anything about it. I talked her into sticking with me for a month before she said yes to a surgery. And after that month, her pain was gone, still never had a surgery, and all the pain's still gone. Multiple stories like that. And it's not because of me, it's because we're getting the body moving and all the biomechanics in place. The nervous system's flowing, the nerves are flowing to the shoulder, and the body will heal itself. That's the answer to your health in all areas, really, is make sure you give your body the optimal ability to heal, not just covering up symptoms. Please, please, please go on the Mayo Clinic and actually read what a steroid or a cortisone shot is. You won't want one afterwards, okay? It actually tells you shouldn't get very many of them because it'll break down the musculature, it'll break down the tendons and ligaments and everything else in your shoulder, and it will lead to a damaged shoulder in the long run, even if it helps in the short term, okay? Taking medications, pain meds, muscle relaxers only cover up symptoms. They actually block your brain from feeling pain. So your problem's still there, and you're actually going to probably make your shoulder worse because you don't feel the pain, which is the warning sign your shoulder gave you in the first place. All right. So hey guys, if you have a shoulder problem or a neck problem, maybe you have a friend or family member that does, go to queencityhealthcenter.com. Look us up if you're in the Charlotte area. Either go to Matthews or our South Park Clinic, and we'll evaluate that for you and see what the possibilities are. See if that's the answer for you. But you always want to do that before you just go and take drugs and medications and get surgeries and things like that, because there's no going back many times, and you don't want to go that direction. Okay, so go to queencityhealthcenter.com and look us up and see how we can help. Hey, share this with your friends. If you have a buddy that has a shoulder issue or a neck issue or whatever, send that to them, send this video to them, and then if they don't live here, we'll help connect them with someone in their area that does, because that's your first step. Did you guys know that chiropractic care is the only thing that's beaten the placebo for spinal pains? Physical therapy hasn't beaten it. None of these medication, surgery, none of these things have beaten the placebo. Chiropractic care has. Okay, this is the reason we have an opioid epidemic, because everybody's going to get medications instead of going in to actually get to the root cause of their problem. All right, hey, you guys have an awesome day. I hope you love that kind of top 3 things that we do for shoulder pain and neck pain. Hope that helped you. And good. Again, think twice before you just go in and get an injection or a surgery or a medication. You guys have an awesome day.